I love working with surgery because I think every day is different.
There is no God anymore.
Mary, don't give up your faith, OK?
The best thing about being a GP is making a difference in people's everyday lives. OK, sorry, I might have just ruined your hair.
It's fine.
Patients here are fantastic. They keep you on your toes.
Don't think I'm that crazy, yeah? I'm not into that stage anymore. Don't make me a psycho.
I've had a good life. I've got 2 beautiful daughters, 2 beautiful granddaughters, and a great grandson. If I died tomorrow, I ain't got no complaints.
Hello, Fanamo Surgery. We need to speak. How can I help?
Come in, Mary.
What are you doing down here?
I've been sent into, it's like being sent to Coventry. So I'm looking at your finger again, is that right? Which one is it? That's a giveaway, isn't it?
The morning is the worst time. I would like to give you praise, because to me you're not David Ward, you're St. David.
OK, well, that's very kind of you to say that. But I think the saints may feel that they're being reduced in stature if I'm elevated to that level, Mary.
You're in my estimation anyway, you are... That's my opinion of you.
Well, that's very kind of you to say that. Now, listen, yeah, you've had one on each hand. Are you happy for me to do it again?
I'm happy with you to go ahead. I'm going to leave it till last. But I'm going to tell you now, you know the X-ray you sent me for?
Yeah.
He was kind enough to refer me to Exon Park.
OK, yes.
Because his words to me were that it's 8 years since I've had the tumour removed.
OK.
And his words to me were that it could...
Keep talking, I'm just going to get this ready. Yeah, keep talking.
It could be the cancer come back, but it had gone to my bones. And I went in and I seen Dr. Hale. She introduced herself and she said, I'm a cancer doctor.
That's very good service, isn't it?
So she said, it's very unlikely that it's cancer.
Yep.
But she wants those bloods and the MRI done before I see her next week.
Yep.
I mean, OK, I'm lucky. It's 8 years since I had it.
Yep.
I didn't even have to have chemo.
No, that's right.
Do you know what? My oldest son, he turned around and he said to me, there is no God anymore.
Well...
And I said, you know, Tony, I'm having second thoughts.
Mary, don't give up your faith, OK?
You bought chocolate?
Always.
Oh, I love you. Bit of chocolate in the morning never hurt anyone.
Diamantino Pereira. Hiya.
My problem is, for my age, I am missing quite a lot of hair.
OK, so when you say you're missing quite a lot of hair, what do you mean?
There's a lot of hair.
OK.
It's missed a lot since more than 1 year.
Is it only when you brush it and wash it, or is it just falling out? You're noticing that it's just...
No, it's just falling out sometimes when I do this. Just put my hair straight.
Sure.
3, 4 come on my hands.
OK.
Every time.
OK.
And it's quite nerve-wracking, you know.
OK. So any ideas what you might think is going on?
I got a depression from the school.
What?
Depression,
OK.
yeah, from school. You take medication too.
OK. Any family history of sort of hair loss or what we call vitiligo with the...
My dad, the back, but...
OK. Oh, is your dad a bit older now?
Right now, I just touched it and one came in my hand.
OK. Hair loss is not very common in teenage boys. However, it can occur in some situations. The most common cause of hair loss is male pattern baldness. This can actually start developing after puberty in late teens, early 20s. Other causes are alopecia areata, psychological emotional stress, thyroid conditions, hairstyling and treatments. Can I just have a look at your hair, first of all, see what's going on here? Okay, so you don't have any specific patches where it's all kind of come out in one sort of bulk, but yeah, it's a little bit thin in some areas. Okay, sorry, I might have just ruined your hair.
It's fine.
Okay, so I think sometimes if you're low in iron, that can cause you to have sort of hair loss. And yes, sometimes stress can have an effect on it, okay? And sometimes it's just one of those things, you know, the hair grows in cycles, and sometimes it just means that the cycle is all at the same time, so it appears that more's falling out than normal. But the first thing we would want to check is sort of iron levels and see if that's a possibility, because like you said, you're growing, so it may just be like that. What's your diet like?
Diet, yeah. Salad, fruit, yeah.
We eat a lot of salad.
Yeah, I'm not a very normal kid. I like healthy stuff.
Okay, so your diet seems like it's good, but you are growing, so sometimes these things can happen. And are you particularly stressed at the moment?
No,
No?
not really, no.
Got exams or anything?
No, when
What year are you
we
in
have
school?
sometimes.
Year 10.
Okay, so first year GCSE, so the stress is coming next year.
Yeah.
Okay, all right. So let's do some blood tests, and then we'll see what the results of that come back, and then we'll have a chat about it, okay?
Okay, let's go do
All right, bye-bye.
Thank you.
The appointment for Musa?
Yes,
Yeah?
please.
How can I help?
Since yesterday, he had cough and flu,
Okay.
and then high temperature.
Okay.
So I gave him Nurofen. It didn't work, and he just kept crying. Yeah.
Has he had a messy nappy?
Yesterday he did, yes, but after that last whole night now.
Okay.
One thing which I felt that he's breathing not well because he's forcing something when he was breathing.
Okay. And no rashes at all?
No.
Hello, you.
Who's this strange man? Hey?
Got really long eyelashes, isn't he? Oh, you're not a very happy bunny, are you? You're not. Oh, okay. So, Mum, when I'm having a look at his chest, I can see what you mean. He really is struggling with the breathing, actually.
Yeah.
So he's sucking in underneath his rib every time he's breathing in. So it may be that there's an infection in the lung. Because the breathing is quite rapid, I'm not really happy to leave it like this.
So I'm going to reach about 110, am I?
Oh, at least. At least.
My mum always said, better the devil, you know. You know, I wish I'd have never given up smoking. I'd have been better off.
I don't know about that.
Are you taking any sugar? You're eating no sugar?
I'm eating biscuits and joy. I think that's what it was.
Biscuits have the three things in life we do not need: salt, sugar, and fat. You'd be better off without the biscuits.
Mary, don't give up your faith.
Why is it all happening?
I can't answer that.
No, you can't.
I can't answer
There is no answer.
All we can do is try our best. Mary has had an episode of cancer a number of years ago. She had a bowel cancer, which had to be removed. She's one of the most stoic people I think I've ever met. She never complains about herself, and she's always concerned more about other people rather than herself. whether you are a believer or not, I think people do better when they feel that there is somebody out there that may be helping their lives. I'm not a huge believer myself, but I've seen how people can get support. And I think, you know, places like churches or mosques or synagogues, whatever the faith is, are able to provide a great deal of support, particularly in trying times. And I think that's why she needs to stay with it. Now, spin around a little bit more and pop that hand up here. That's good. Let's pop that out
Now, I
here.
know this is going to hurt.
Right. Now, listen.
And I'm sure you love doing it.
Not quite as saint-like as you thought then.
You are a saint. You are a wonderful gentleman.
OK, Mary, try and hold as still as you can. I'm sorry about that. Well done. Well done.
Do you know what? The liquid going in hurts more than the needle.
Probably. What I might do is see if I can get you back in again in a couple of weeks maybe, yeah? And then we can see how that's gone, yeah?
Yeah. And talking of my health, why don't you write to your people in Australia and tell them to send a sack full of nice weather over here?
What are people going to do if they can't complain about the weather? It's a national pastime, Mary.
It's now nature, I presume. So thank you so very, very much for seeing me again. I know I'm in your nuisance. I won't swear.
Oh, Mary. Let's see how you get on, hey? And I'll see you on the 15th.
Thank you. And you are still St. David. You definitely are.
OK, Mary.
Thank you.
Bye-bye then. Bye.
Hi, could you do the paediatric reg on call, please, for a referral? It's one of the GPs in Slough. Thank you. Oh, hi, my name's Amit. I'm one of the GP regs in Slough. Hi, I've got a baby that I'm a bit concerned about. It's a 16-week-old boy, Musa Syed. My main concern is that he's febrile at 38.1 with a rest rate of between 60 and 70, and there is subcostal recession and some crackles at the right base. Yeah, blood, sure. Sure. OK, thank you, bye. OK. So that was the paediatric doctor, so they're happy. Are you OK?
Yeah.
It's all right. Look, the paediatric doctor did say that usually, in most cases, this is a virus that causes difficulty in the airways, OK? And typically babies get better with this, OK, after some observation. But obviously we're just being careful because the breathing rate's quite fast and because he seems to be working quite hard.
Yeah.
He may well need to have some blood tests just to make sure there aren't any serious signs of infection, okay? But if those are all normal and baby improves, then you may be able to go home today, okay? So, you know, I can understand it's worrying, but, you know, they'll take good care of him and do what's necessary. Okay.
Thank you very much. Okay.
Take a seat through in the waiting room.
I'll give it a few minutes.
Just through there.
How are you today?
Basically, my ankle and my leg, believe it or not, keeps swelling up so bad I'm in pain in my thigh, the back of my leg and my back. Now, I know I've got type 2 diabetes and they keep checking my ankles and feet to make sure the blood's flowing for. It's constantly swelling up.
But this swelling, is it something new or recent?
No, I've had it for years.
What was the trigger why you came today?
It's getting to the plane out. I can hardly walk on it.
Okay. What about the left leg? Is
Left
okay?
leg's fine.
So let's do a little check now today. Quick check on your legs. Any pain when I press there?
No.
That hurts?
Yeah.
And when I move the...
I can only go up and down.
Up and down, yeah.
That's fine.
Any pain there?
Not at the moment.
Okay.
Do you want me to put these back on now?
Yes.
I wasn't expecting to come straight round here, to be honest with you.
So clearly, a certain amount of retention of the fluid is allowed, especially if you had a previous surgery or fusion surgery and everything. Do you smoke?
I do smoke, yeah.
How much do you smoke?
All depends, to be quite honest with you. Sometimes, if I'm bored, I would say roughly between 20 and 30 in a night.
So you do know that the smoking is injurious to health?
Yes, after all these years, I think so, yeah.
How many years have you smoked?
I've been smoking since I was about 11.
Okay. Smoking is injurious to health. It can cause cancer, lung cancer and issues like that. Yeah.
I'm not being disrespectful to anybody. I've had a good life. I've got 2 beautiful daughters, 2 beautiful granddaughters and a great grandson. If I died tomorrow, I ain't got no complaints.
Okay. So help is available once you're ready to quit. But you have mentioned what you've mentioned now. So we'll have to just leave it there, but also please be sort of aware that there's an offer there.
Yeah, I understand, yeah.
As a first thing, I would recommend or advise that we get an X-ray done and look at options of whether you need to be further seen by the orthopedic doctors. So you can walk in between 8 o'clock in the morning to 8 o'clock in the evening to Wexham Park Hospital on any of the weekdays.
Oh, great stuff. That's even better.
It's a walk-in service, yeah.
So I can actually just walk in there?
Just walk in and say, my doctor has ordered the X-ray online in his GP clinical system.
Dr. Lee, yeah?
Dr. Nanda, myself. Okay?
Cheers.
All right,
Thank you very much indeed.
All the best.
Yeah, and you, my friend. Take it easy.
Bye-bye.
Cheers.
Bye.
Ta-ra.
Hiya.
Hi ladies, all right?
Good, thank you. How are you?
Yeah, don't hook it up, like, you know, just sit there, you know.
We've got work to
You've
do.
got tea, like, you know.
We've got work to do.
Alana Burnett Thomas. Hello, come on through. You all right?
Yeah,
Is it that pesky nose of yours, is it again?
I know. She has them 4 or 5 times a day. Last night she had one for about 40 minutes. The school
Oh.
phoned me today.
Yeah.
So it started at 9 and...
It ended after assembly.
Did it?
So,
How long's assembly?
20 minutes.
Oh my goodness, that did go on a bit, didn't it?
So I was just lining up from breakfast club and I was just about to go and then it was just dripping.
And is
when I was
it
walking
that
up
right
to the
nostril
playground.
or is that
This
side?
one, yeah.
And what do you do when it starts?
Do you pinch your nose?
Brilliant,
Yeah.
good girl.
I think the teacher helped, because it went on from 9 till 11.
Yeah.
Through the assembly, I think the teacher pinched onto it for about 15 minutes.
Yeah. Any signs of tiredness or anything like that? Are you concerned in any way?
I don't think so, no.
And is it a lot that she's losing? Can I have a little peek up your nose? Is that all right? Okay, Poppy, so I'm just going to literally put that at the edge of your nose. Just going to go in a little bit. Is that okay? Good girl. Yes, you can see it's at the bottom of the nostril, right at the back.
Right.
Where it is. You've obviously got a weak vessel there.
Okay. That's what my teacher keeps on saying. She says that I've got a weak vessel
Is she
and they
worse when
keep
she
on
gets hot?
bursting. She says, sit in the shade and stop running around.
Yeah, because if you get a bit hot
Yeah, of
dilated,
course,
that
yeah.
can do it.
Yeah.
But it's still got to be looked into,
Yeah,
really,
okay.
for her.
No problem.
Does she ever vomit as well? Because it trickles into the back of the throat.
Yeah. This is what's really upsetting her.
If you are sick, shall I tell you why it's happening? When the blood trickles down into your tummy, your tummy doesn't like it being in there. So because it doesn't like the blood, it makes you sick to get rid of it. So literally every day it happens.
Yeah. Not just once either. How many do you have at school? You have a couple at school and then a couple at home, don't you?
Yeah.
It's 4 times. And it is every
But
single day.
this whole week I've had no
Since September. By Wednesday, phone in and just see if there's an update
Yeah.
at all with the referral and we can see what's going on. Does that sound
I
okay
appreciate
with
that.
you?
Yeah, that's lovely.
Brilliant.
Okay then,
All
thank
right,
you very
take
much for
care. I'm
seeing
sorry
us.
you're going through this. Look after yourself. Bye-bye.
How do people get through life without being able to read or write? Like how do they pass their driving test?
She probably doesn't drive.
How can I help, David?
An incident happened and I got an injury on my eye. I woke up this morning and it was really hurting and watering.
Okay, and what happened? You got a punch to the face?
Yeah.
Okay.
It was swollen and you can see there's a cut underneath where they've glued it.
Okay, I've looked at the letter. It says the CT scan didn't show a fracture or anything, you know, of the orbital, so that's the bones around the eye. And they said that the scan in the brain didn't show a bleed or anything, so they obviously discharged you. And did you lose any consciousness when it happened?
For a couple of minutes, yes.
Since Saturday, have you had any vomiting?
No.
Any double vision?
It's a bit blurry, that's about it.
Just switch this light on. Look down for me. Is that hurting?
Yeah.
Okay, I'm just going to have a look. So this pupil's contracting quicker than this one. It's still narrowing, but not as much as the other eye. So I think looking at the eye and the health of the eye and your symptoms, I don't think there's anything too nasty going on, but in case there's a scratch on the surface of the eye and the fact that your eye's now watering and the pain's getting slightly worse does concern me. You need to get the eye looked at properly. And when you tell them what's going on, they should hopefully see you straight away.
What I need to do today is just examine the knees.
Yeah.
Does that cause you pain when I'm bending it?
Discomfort, that's not pain.
That's fine. Put your things back on. Okay. So it's difficult to say what's causing your pain at the moment. When I'm moving your knee, it's got a good range of movement, actually. So I think, you know, a first point of call would be an X-ray. That we can arrange that. Usually takes about a week for us to get the report.
That's fine.
Yeah. In the meantime, how do you feel about some physiotherapy, maybe?
As long as it stops it hurting, I don't know.
Now, if any symptoms, if you ever get it sort of locking in a straight position like that and it gets stuck, or the giving way gets worse, obviously come back and see us.
There was one other thing I wanted to talk. I've been getting angry very quick recently. My wife's noticed it a lot. I did have depression a while back. I just don't want it coming back, if you know what I mean. And this seems to be a thing that happens.
Okay.
I needed to not talk to someone, but mention it, because I don't like the way it's going, to be fair.
I can see you look quite anxious. Yeah. And how long has this been sort of affecting you for more recently?
A few months. It hasn't helped. I lost my dad last month.
I'm sorry to hear that.
But I haven't been sleeping very well either. So I don't know. But it's been going on for a couple of months. And then with that, it's just...
Okay, it's kind of made things a bit worse, presumably. Okay. And who else is at home with you? Is it just yourself and your wife? Was your father's passing, was it expected or was it...
No, unexpected.
No.
But that isn't what's caused this.
No,
things were going on it's been going on for a while.
Yeah. And have you identified any things that could have made things worse over the last few months?
What I can think of is just me.
How are things at work?
Yeah, okay. Good.
And things between yourself and your wife otherwise?
Yeah, fine.
Yeah?
Yeah, we're good.
Yeah, okay.
I just don't know what it is.
Do you feel low in yourself?
Sometimes.
Yeah. Do you ever get any harmful thoughts?
At the moment, I feel quite bruised, almost like someone's taken my ovary out and punched it a few times and put it back in. It's really sore.
And what's happening is that when I'm urinating, I'm getting a lot. It feels as if I've been getting a stitch.
2 weeks ago, I took all these paracetamol with codeine. It was worse. It was like a drug for me.
When I'm coughing, it really burns. Like, it feels like a mini explosion inside my chest.
It's very sore down there on the right, isn't it? I know you said you've had this sort of pain before. It's in the right place for your appendix. I know you haven't got a temperature. but you are guarding in that area. So I think I need to ask someone to see at the hospital today just to check.
Do you ever get any harmful thoughts?
I have, but not to the point where, you know, I've sort of, don't be so stupid to myself kind of thing. You know, it's
So
the thought. It's a thought, then it's dismissed. Yeah.
So no specific plans to
No. Oh no.
Okay.
Definitely not.
Had you had a thought as to what you might want to do to try and start improving things?
I don't know. My freedom was going out on my bike.
Okay.
I can't do it.
No, because of your pain.
I'm not allowed to do it.
Yeah. So, I mean, there's a few options, and I think it largely depends on how you want to kind of approach things now. You were on medications before, and that's one of the ways in which we try and help people who are suffering with symptoms of depression, but that really just kind of, it's not a cure as such. It can try and control the symptoms, but really to get to the root of things, we often recommend counselling as one option. It's called talking therapies in this area, but essentially it's a form of counselling.
Yeah.
Have you ever had something like that before?
I haven't, and to be fair, I don't feel comfortable doing that.
Yeah. Okay.
I don't talk.
Yeah. I mean, what we can do is start you on a tablet again for your mood.
Okay.
Okay. Something called sertraline.
All right.
Very similar to citalopram. Typically, things can get a bit worse for the first sort of week or so being on the medication, but then, generally speaking, after the first month, you should hopefully, if you're going to see improvements, you start seeing them.
Okay.
How does that sound? Would you want to consider that?
I'll try it and see what happens.
And then maybe we can see you again in a couple of weeks' time, see how things are getting on.
Okay.
Yeah? All right.
Thank you very much, sir.
Okay.
Cheers.
No problem. Take care.
I have the 16th.
I was wondering if I can see someone to get wax taken out of my ear because I'm having problems
Are you
hearing.
patient in the surgery?
Sorry?
Are you patient in the surgery?
Well, I'm from Australia. No.
From Australia. What you can do, you can go to the walk-in centre. That's the address it is. It's in the high street. Because they'll probably tell you to put drops in your ears, just loosen the wax anyway.
Surely somebody can do that because I'm flying on the plane.
I know, but you can't get it done here because first of all you're not registered.
It takes 10 minutes.
I know. That's the only people who can help you if you want the number.
This
okay?
is stupid.
Well, it's not stupid because you're not registered here.
Well, it's like the World Cup final, isn't it? What happened there? You know, we finally managed to come back a little bit, and then they just knew how to put the foot on the accelerator. So you're not doing well, mate, according to this essay that I can see in here.
I just don't know where I'm going. I'm so...
Why? What's happened?
Oh, I've got loads
differently.
of things. I've got loads of things going on in my life at the moment. 3 weeks ago, he actually attacked me. That's my wrist up, yeah? Okay? I got arrested for assault. I'm out on bail for ABH. Yeah? I've got 2 witnesses who said he's attacked me, but I haven't even questioned them. I mean, all this is just... And then I get home on Sunday, got a letter from a copper, we need to speak to you. So I phoned them up, they said, oh, your dog's been reported for attacking people and children. We need to sort it out. And I started losing because I just started losing it big time, yeah, and I just left the phone on and walked away, yeah, because I just couldn't answer it, yeah, I just could not answer the question.
I've known David for many, many years. He has a number of problems that were going on, one of which was a fall whilst having an altercation, which led to an injury, and he ended up having to go and have an X-ray. So 2 problems. Firstly, the wrist and his pain, but secondly, the altercation and what came after that, which is affecting him quite badly.
Yeah, it's just constantly, yeah. And I mean, Sunday, yeah, I just lost it big time. And I literally got home and I had my drugs out and everything. And I was quite happy just to end it all because it's just, at the moment, no one seems to be giving a... Well, sorry about the language, but that's how I am really...
Mate, I can understand how you feel because, you know, not many people have that many things going on at the same time, do they? Do you know what I mean? You've had this and this and this and this and this, and they're all getting on top of you to the point where you're at breaking point. Two things. Okay. Firstly, I want to get you back next week and see how you're getting on. Okay.
Yeah.
You know, I don't have a miracle for you. You know, I can't change all of those things for you.
No, I know.
Do you know what I mean? But I can listen to you and I can agree with you, and we can talk about ways forward that you might be able to take to try and help this out.
This wrist, hang on. There was a letter sent to you, but I know you don't. Or you don't read it, one of the two. About this wrist, yeah. One consultant is saying it's broken, the other one saying it's not. I'm in absolute agony with it, yeah. I'm in absolute agony with it, especially around this area.
Okay, we need to X-ray that again. Because your pain is down in here, in that area there.
Yeah, it's all.
Okay, so if I press in there, so this is what we call your.
Right,
so it doesn't matter what it's
around
called.
this area is really.
But you've got a little bone under here that if you break that bone, then you can run into real trouble. Okay.
I mean,
the difficulty is that it doesn't always show up straight away on X-ray.
I mean, the bruising's gone down a hell of a lot, yeah, and it wasn't any.
So you are sore in there, aren't you?
Yeah.
Okay. So we re-X-ray.
Any swelling as such.
What I want to do, okay, so there's two bits to this, okay? I've organised an X-ray for that, okay? You need to go tomorrow to Wexham, okay?
Yeah.
Between 8 a.m. and 8 p.m.
Yeah. No.
Okay, they will do special views to try and look at that bone, okay? We're going to continue this conversation next week.
Yeah.
Okay, mate.
This is the problem.
This.
I know you only got a short time to see me, yeah, and I mean, sorry, yeah, I know, but yeah, I mean, I know.
Look, I understand, mate, and I understand your frustration, and I understand how you're feeling, and I understand exactly what it is. This is to try and help you sleep a little bit at night.
All right.
Okay, 2 in the evening. They're not addictive or anything like that. Their side effect is that it makes you sleepy. It's no guarantee, but it might help a little bit. And next week you can tell me how you're getting on with them.
All right.
Okay, mate. Look, we'll have a chat next week. Okay. Yeah.
But I have no family I can actually go and speak to. I might go on a Jeremy Kyle show and be an idiot, yeah, like all the rest. They always seem to be on benefits and. Yeah, we walk on stage and it's supposed to be on disability benefit. Yeah.
But if you go on Jeremy Kyle, you'll end up punching somebody, won't you?
Yeah, but
that'll be all over, and then you'll be back in front of the police station.
Yeah, so I just. Thanks, okay.
Cheers, mate.
Farnborough Surgery, you've been to Pam. How can I help? Oh, hello.
How can I help you?
I was diagnosed with anorexia nervosa, and so I was in and out of food disorder clinics and things like that, and so they said to go for a bone scan just to check on things, and it was found that my bone density was quite low. I was told that I had early onset osteoporosis then. I was told that a follow-up scan would need to be done 2 years later, so that would have been 2012, and I've still not had it done yet.
All right.
And I was kind of worrying because, like, when I get up, mostly in the mornings, like, I really ache. It takes me a while to be able to get out of bed, and, like, and I'm just worried about, like, as I get older with osteoporosis now, that it's going to affect me more.
How old were you in that time?
14, 15.
14. And now since then, are you eating all right?
Better, yeah.
All
Much
right.
better.
You look happy.
Yeah.
All right.
A lot
Okay.
healthier than I was.
And how is your weight doing?
Good, I think.
You put on weight?
Yeah.
Okay. And how about your periods?
Good.
Yeah.
Fine, absolutely
Passing, urine, bowels.
Yeah.
And you mentioned this joint pains, or is it just one pain?
Just general aches and pains. More so when I'm active, like if I'm doing a lot of walking. I play football quite a bit. So more so then I ache a lot after, whereas like normally someone might ache a bit after the gym, like I ache thoroughly after the gym.
Are you on any medication on a regular basis?
No.
Like steroids or anything like that?
No, nothing like that. Never have
All right. Okay. And what do? Do you work or are you studying at the moment?
I'm an SEN teaching assistant at the moment.
All right. How is that going on?
Great.
Okay. All right. So basically, you want to make sure that you have a scan and that you don't have osteoporosis or is it not progressed.
It's not progressed and got worse.
All right. Okay. Now have a quick look at the notes if that's okay with you. Were you given some vitamin D tablets and things as well at the time?
Yeah, I was given Adcal D3.
So your BMI is okay at the moment, but I think it should be okay to organize a scan. The reason why I was doing it because there are certain criteria we need to meet for a scan, and sometimes they reject it. All right, so that's done.
Okay, thank you.
Okay. Obviously, if you don't hear from them in 2 to 3 weeks' time, just ring the secretaries to find out if the form has been anywhere declined or anything. Yeah? Okay.
Thank you.
All right. Yeah.
Daniel Zaloga, please. Okay, how are things?
Yeah, I come down with it. I've got a small problem. Actually, it's a habit. I do smoke ganja for a couple of years now, and it came to that stage. It started ruining my life, relationship, and stuff like that. I end up in police station.
I called the police.
Yeah, my mom trying police because
I called police because
I lost the control of my brain and body.
What happened?
in the morning on Friday, he called to me and he told me I killed myself, blah, blah, blah. You see one person, inside is two guys. One is good, one is bad. Sometimes he don't have a control of himself.
It's not that I don't control, I just got short
Daniel
temper.
don't have a control because he is a little bit angry.
How do you feel about this? I mean, would you say that's true?
Yeah, that's sort of true. When I've got a short temper, I'm not gonna say I have got short temper.
He needs help, you know.
Yeah, I need some sort of medication to come off from marijuana.
Daniel was a 23-year-old guy that I saw with his mum. I've seen quite a few patients now in their early 20s who come with parents or girlfriends. I think it's quite common now, and actually for me as a GP, it gives me quite a nice insight to speak to a relative as well. It gives me an idea of how cannabis use is actually affecting other people in their lives. How long have you been smoking marijuana for?
Oh my gosh, my friend, I've been smoking for...
Around 8 years.
8 years now.
He smoked around 15 joints a day.
15, so over 3.5 grams in a day. I'm even reaching 5 grams in a day.
Okay. And apart from marijuana, any other drugs that you take? Or any tablets or any injecting? No? Okay. Do you drink alcohol?
Once in a blue moon.
Once in a blue
Like
okay.
everyone.
Okay. Do you ever, just a few other questions about your mental health. Do you ever see or hear things that aren't there? Anything like that? Nothing like that?
I didn't get to that level.
At the moment, maybe no. At the moment.
Yeah.
He have it after, so you know, like he's...
You mentioned...
No, listen, don't think I'm that crazy, yeah?
You know,
I'm not into that stage anymore. I'm not in that, I've never been in that stage. Yeah? Don't make me a psycho because I know where I am. It's just a bad habit. So don't chat shit, yeah? You understand? Don't talk shit because I don't like it.
So, Chris, can I call you Chris?
Yes, please do. Yeah.
Okay, Terence is my name.
Okay.
I've got a big heart.
Oh, I
Believe
bet.
me, I've got a
I
really
bet.
big heart.
Oh, thank you.
You're
Thank you for doing that.
You're welcome. All right, take care. All right, take care. Bye-bye.
Don't talk shit because I don't like it.
Okay, let's bring this back to your symptoms, okay? Yeah. So, apart from the anger, you've mentioned on one occasion you rang your mum, you said you felt like ending your life. Do you remember having that conversation?
I said I'm gonna kill someone else. That's the reason I end up in police station and...
Okay. Do you feel like that a lot? Do you feel like you have a lot of anger? Do you feel that you're likely to harm other people?
Yeah. Yeah, I quickly get angry. I lose my temper quickly.
Okay. So here's the thing. We know that smoking marijuana as regularly as you are doing definitely has mental health side effects. Yeah. Okay. So I think there's a lot of evidence now gathering about the link between cannabis use, and in particular skunk, and mental health problems. In this consultation, I spoke to Daniel quite a bit about some of the other side effects that maybe he'd been experiencing, things like seeing or hearing things that aren't there. But also other mental health problems like low mood and depression often coexist with cannabis use. But often the first point of call is to try and address the drug habit before you then go on to try and deal with the mental health problems. So, you've done the right thing by coming here today, okay? I think that's a positive step.
Yeah.
So, first instance, I think we need to get you some help with one of the drug workers who works in the drug clinic in Slough.
I would really appreciate that.
So if you feel that some of the side effects, so your anger, or you feel that you're feeling like harming yourself, or anything like that, you must come back and see us, okay? Because sometimes we also need to refer people sometimes to psychiatrists who deal with mental health and drug abuse, okay? But I think the place to start is to try and get you to reduce your amount of smoking and eventually stop it, okay? All right.
See you.
All right, take care. All right, bye-bye.
Mr. Chiappetta, come in. Thanks for waiting.
Thank you very much to see me.
That's okay. Take a seat over here, please. That's it. My name's Sheila.
Hi, Sheila.
Hi there. How can I help you?
I just cut my finger on the...
What were you doing?
I was trimming a door with a circle saw my hands there.
Okay, was it a circular saw? Okay, I'll take that off and we'll have a look.
That one is not bad, but this one, it look quite deep.
Okay.
I put out for all.
Yeah, I can see. Are you diabetic?
Yes, I am.
Okay. Oh, you're good at DIY, are you?
Yeah, cut my finger. You can see how good I am.
That's it. Right, let's have a look here. So what state are the doors in at home now?
Oh, it's all right. I didn't kick at the door.
Okay.
And I didn't destroy the saw either.
You didn't destroy the saw. Those circular saws
They're dangerous.
can be lethal, can't
Yeah.
they? Oh, this is really wrapped round, isn't it?
I could stop bleeding, so
Where's the end of it?
I think it's on the bottom.
I've got it here, yeah. Oh, my goodness.
You make a good mess.
I think that might need stitching, you know. Hold that on there for me, please. It's quite deep. You being diabetic, you've got to be really, really careful, as you know, with your, you know, your extremities, your fingers.
Yeah.
Can you feel this?
Yeah.
Can you feel this?
Yeah, it's a bit dull, but I still feel
A bit dull, yeah.
Yeah.
So we just need to make sure that there's been no damage inside the finger.
Oh, yeah.
Okay, I'm going to put a dry dressing on here for you.
Okay.
This one, I'll dress it, but you do need to go up to the A&E and probably you might even need an X-ray on it because that's gone in quite deep.
Okay.
Okay? Okay, right, if you hold that there and I'll just get some bits and pieces. Will you take yourself up there now or not?
Yeah, well, I have to go pick my wife up anyway.
Yes.
She works in the hospital.
What does she do there?
She works in catering, in the kitchen.
Oh, yeah, yeah. That's it. Oh, my goodness me. It'll get you out the washing up anyway. OK, let's just... I'll just quickly write you a letter.
All right,
and then
and
I'll
I'll
bring it
go straight up there, yeah.
Yeah, and then go up to A&E, OK? OK, then, I'll just be a few minutes. All right? No worries.
Thank you so much.
You take care. All right, bye-bye.
Bye. Thank you very much, Dr. Joangie, as usual.
Thank you very much for your help.
You're welcome. Nice to see you.
Bye.
Bye-bye. Thank you for coming in.